Would you like free audiobooks? Click the link in the description. Question 1. A nurse is caring for a client who has just undergone a renal biopsy. What is the most critical action for the nurse to take post-procedure? A. Encourage high fluid intake. B. Place the client in a supine position for 6 to 8 hours. C. Monitor the biopsy site for swelling. D. Check blood pressure every 15 minutes for the first hour. Correct answer, B. Rationale: after a renal biopsy, the most critical nursing action is to place the client in a supine position for 6 to 8 hours to reduce the risk of bleeding and promote clot formation at the biopsy site. Frequent monitoring of vital signs, especially blood pressure, is crucial to detect signs of internal bleeding. Question 2. A nurse is planning care for a patient with chronic kidney disease, CKD, and hyperphosphatemia. Which dietary modification should the nurse include in the patient's care plan? A. Increase intake of dairy products. B. Avoid high potassium foods. C. Restrict foods high in phosphorus. D. Limit fluid intake. Correct answer: C. Rationale: in patients with CKD, impaired kidney function leads to an inability to excrete phosphorus. High levels of phosphorus can cause bone and cardiovascular problems. Limiting foods high in phosphorus, such as dairy products, nuts, and beans, is essential in managing hyperphosphatemia. Question 3. A nurse is assessing a client with suspected glomerulonephritis. Which symptom would the nurse expect to find? A. Hypotension. B. Polyuria. C. Hematuria. D. Hypokalemia. Correct answer: C. Rationale: hematuria, the presence of blood in the urine, is a common symptom of glomerulonephritis, resulting from inflammation of the glomeruli within the kidneys. This condition often leads to red or cola-colored urine. Question 4. A nurse is caring for a client with end-stage renal disease, ESRD, on hemodialysis. What is a priority nursing intervention for preventing complications during dialysis? A. Administer sedatives regularly. B. Monitor for signs of disequilibrium syndrome. C. Increase protein intake on dialysis days. D. Encourage ambulation during dialysis. Correct answer: B. Rationale: disequilibrium syndrome can occur during or after hemodialysis, characterized by neurological symptoms like headache, nausea, vomiting, and confusion due to rapid changes in blood composition. Monitoring for these signs is crucial to manage and prevent this complication. Question 5. A nurse is reviewing laboratory results for a client with acute kidney injury, AKI. Which lab finding is most indicative of AKI? A. Decreased serum creatinine. B. Elevated blood urea nitrogen, BUN. C. Decreased white blood cell count. D. Elevated hemoglobin levels. Correct answer: B. Rationale: an elevation in BUN levels is commonly seen in AKI due to decreased renal filtration. It is important to monitor kidney function tests, including BUN and creatinine, to assess the severity and progression of AKI. Question 6. A client with nephrotic syndrome has edema, hypoalbuminemia, and proteinuria. Which pathophysiological process should the nurse explain to the client as the primary cause of these manifestations? A. Hypersecretion of aldosterone. B. Increased glomerular permeability. C. Decreased renal blood flow. D. Obstruction of the urinary tract. Correct answer: B. Rationale: in nephrotic syndrome, increased glomerular permeability allows proteins, especially albumin, to pass into the urine, leading to proteinuria and hypoalbuminemia. The loss of albumin decreases plasma oncotic pressure, causing fluid to accumulate in tissues as edema. Question 7. A nurse is evaluating a client for potential postrenal acute kidney injury, AKI. What assessment finding supports this diagnosis? A. Flank pain. B. Decreased specific gravity of urine. C. Presence of urinary casts. D. Prolonged anuria despite adequate fluid intake. Correct answer. D. Rationale: postrenal AKI is often caused by an obstruction in the urinary tract that prevents urine excretion, leading to conditions such as anuria, no urine output. This finding, particularly when fluids are adequate, strongly suggests a postrenal cause. Question 8. A client with acute renal failure is undergoing evaluation. The nurse should prioritize assessment for which potential cause? A. Analgesic overuse. B. Recent history of streptococcal infection. C. History of benign prostatic hyperplasia. D. Excessive consumption of protein. Correct answer. C. Rationale: in acute renal failure, particularly postrenal, the history of conditions like benign prostatic hyperplasia, BPH, is significant because BPH can lead to urinary retention and obstruction, contributing to renal failure. Question 9. A nurse is assessing a client with polycystic kidney disease. Which clinical manifestation most strongly suggests acute complications related to the disease? A. Hypertension. B. Polyuria. C. Increased abdominal girth. D. Nocturia. Correct answer. C. Rationale: increased abdominal girth in a client with polycystic kidney disease may suggest the rapid enlargement of cysts or the development of complications such as cyst rupture or infection, requiring prompt assessment and intervention. Question 10. A nurse is providing dietary counseling for a client with early-stage chronic kidney disease, CKD. Which dietary restriction is most appropriate to recommend? A. Low carbohydrate. B. Low protein. C. High calcium. D. High phosphorus. Correct answer. B. Rationale: in early-stage CKD, a low-protein diet is recommended to decrease the workload on the kidneys, thereby slowing the progression of kidney damage. Limiting protein helps reduce the accumulation of urea and other nitrogenous wastes. Question 11. Which finding would a nurse expect when reviewing the laboratory results of a client with acute glomerulonephritis? A. Decreased C-reactive protein. B. Elevated antistreptolysin O titer. C. Low erythrocyte sedimentation rate. D. Decreased serum complement levels. Correct answer. B. Rationale: elevated antistreptolysin O titer indicates a recent streptococcal infection, which is a common precursor to acute glomerulonephritis. This finding helps confirm the diagnosis, particularly when correlated with clinical symptoms. Question 12. A nurse is caring for a client who reports significant weight gain, shortness of breath, and ankle swelling. The nurse notes that the client's serum albumin is low. Which condition should the nurse suspect? A. Hypovolemia. B. Dehydration. C. Heart failure. D. Nephrotic syndrome. Correct answer. D. Rationale: these symptoms, coupled with low serum albumin, suggest nephrotic syndrome, which often presents with edema due to hypoalbuminemia and fluid shift from the intravascular compartment into the interstitial spaces. Question 13. A nurse is assessing a client with end-stage renal disease, ESRD, who missed their last 2 hemodialysis appointments. Which assessment finding is most concerning? A. Hypotension. B. Bradycardia. C. Hyperkalemia. D. Hypoglycemia. Correct answer. C. Rationale: hyperkalemia, elevated potassium levels, is an acute, life-threatening condition that can occur in clients who miss dialysis treatments, as the kidneys are unable to excrete potassium. It can lead to serious cardiac complications. Question 14. A nurse is preparing to administer medication to a client with renal insufficiency. What is the primary adjustment the nurse should consider? A. Doubling the dosage. B. Increasing the frequency of administration. C. Reducing the dosage. D. Switching to intravenous administration. Correct answer. C. Rationale: in clients with renal insufficiency, the kidney's ability to excrete drugs is diminished, requiring dosage adjustments to prevent toxicity. Typically, this involves reducing the dose or extending the dosing interval. Question 15. During a community health screening, a nurse identifies a client with a blood pressure of 180/95 mm of mercury. The client also reports a recent increase in nocturnal urination. What should the nurse anticipate as the first step in managing this client? A. Recommend immediate dialysis. B. Advise dietary sodium restriction. C. Schedule the client for a renal function test. D. Prescribe an antihypertensive medication. Correct answer. C. Rationale: the combination of high blood pressure and nocturnal urination can indicate underlying renal issues. The first step should be to evaluate renal function to guide further management, including whether medications or dietary changes are needed. Question 16. A nurse is providing education to a client with a history of kidney stones. Which type of beverage should the nurse encourage the client to avoid? A. Citrus juices. B. Dairy-based drinks. C. Caffeinated beverages. D. Herbal teas. Correct answer. C. Rationale: caffeinated beverages can increase calcium excretion in urine and decrease urine volume, both of which can contribute to the formation of kidney stones. Avoiding these beverages is recommended to reduce the risk of stone recurrence. Question 17. A nurse is monitoring a client for signs of complications following a kidney transplant. Which symptom would indicate an urgent need for medical evaluation? A. Pain at the transplant site. B. Increased urine output. C. Hypertension. D. Slight redness around the incision. Correct answer. A. Rationale: while slight redness and increased urine output can be normal post-transplant, pain at the transplant site may indicate complications such as infection, rejection, or surgical issues, requiring immediate medical attention. Question 18. A client with diabetic nephropathy has a serum creatinine of 2.6 mg per deciliter and a GFR of 35 ml per minute. What is the most appropriate nursing intervention? A. Initiate aggressive fluid resuscitation. B. Prepare the client for immediate dialysis. C. Monitor kidney function and control blood sugar. D. Recommend discontinuation of all diabetic medications. Correct answer. C. Rationale: in clients with diabetic nephropathy, controlling blood sugar is crucial to slowing the progression of kidney damage. Monitoring kidney function helps assess the effectiveness of management strategies and the need for potential adjustments in treatment. Question 19. A nurse is caring for a client with hyperkalemia. What medication should the nurse be prepared to administer to rapidly decrease potassium levels? A. Calcium gluconate. B. Insulin. C. Sodium bicarbonate. D. All of the above. Correct answer. D. Rationale: in the treatment of hyperkalemia, calcium gluconate is used to stabilize the heart muscle cells, insulin helps to drive potassium back into the cells, and sodium bicarbonate can help shift potassium into cells if acidosis is also present. These medications are often used in combination to rapidly decrease serum potassium levels. Question 20. A nurse is assessing a client for complications associated with peritoneal dialysis. Which symptom would indicate possible peritonitis? A. Cloudy dialysate effluent. B. Increased urine output. C. Hypertension. D. Weight gain. Correct answer. A. Rationale: cloudy dialysate effluent is a classic sign of peritonitis in clients undergoing peritoneal dialysis and requires immediate medical evaluation and treatment to manage the infection and prevent more serious complications. Question 21. A client with acute kidney injury is experiencing metabolic acidosis. Which intervention should the nurse expect to implement to correct this imbalance? A. Administration of IV fluids. B. Administration of sodium bicarbonate. C. Decrease in respiratory rate. D. Administration of calcium supplements. Correct answer. B. Rationale: sodium bicarbonate is commonly used to correct the metabolic acidosis associated with kidney dysfunction by neutralizing excess acid in the blood, thus helping to restore the body's normal pH balance. Question 22. A nurse is caring for a client who is 2 days post-operative from a kidney transplant. The client's serum creatinine level has increased. What is the most likely explanation for this finding? A. The transplanted kidney is too small. B. There is a possible rejection of the transplanted kidney. C. Normal post-surgical swelling is affecting kidney function. D. The client is dehydrated. Correct answer. B. Rationale: an increase in serum creatinine shortly after a kidney transplant is a concerning sign that may indicate acute rejection of the transplanted kidney. This requires immediate evaluation and potentially aggressive treatment to save the new kidney. Question 23. During a health screening, a nurse identifies a client with a risk for chronic kidney disease due to hypertension. What is the most effective strategy for reducing the risk of developing kidney disease in this client? A. Immediate initiation of insulin therapy. B. Regular monitoring of kidney function and blood pressure. C. Starting an aggressive weight loss program. D. Prescribing antibiotics as a preventive measure. Correct answer. B. Rationale: regular monitoring of both kidney function and blood pressure is essential in clients with hypertension to prevent the progression to chronic kidney disease. Effective management of blood pressure can significantly reduce the risk of kidney damage. Question 24. A nurse is caring for a client with a history of renal calculi who reports sudden, severe flank pain radiating to the groin. What is the priority nursing action? A. Prepare the client for surgery. B. Administer prescribed pain medication. C. Encourage high fluid intake immediately. D. Arrange for a renal ultrasound. Correct answer. B. Rationale: the priority is to manage the client's acute pain effectively. Administration of prescribed pain medication should be done promptly to alleviate severe pain and discomfort, followed by further diagnostic evaluation to assess the need for additional interventions. Question 25. A client is undergoing evaluation for a potential kidney donation. Which criterion would immediately disqualify the client from donating? A. A history of hypertension. B. Over the age of 60. C. Blood type incompatibility with the recipient. D. History of occasional smoking. Correct answer. C. Rationale: blood type incompatibility between the donor and recipient is a critical factor that can lead to immediate rejection of the transplanted organ. This incompatibility disqualifies potential donors as it poses a significant risk for acute transplant rejection. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.